In most emergencies, you would have to act immediately to prevent the situation from worsening or to save lives. This is what we call a reactive approach to emergency management. Now, the types of emergencies that could occur would include things like serious injury, medical emergencies like a heart attack, fires and explosions, hazardous substances or chemical spills, explosions or bomb threats, security emergencies such as armed robbery, intruders, and disturbed persons, loss of power or structural collapse, natural disasters like floods, storms and bushfires, traffic accidents, or even landslides and wall collapsing. Sometimes, emergencies can overlap and cause dangers to life and health, or life and the environment. Let us take a look at a few examples of dangers to life emergencies. These are emergencies that pose a danger to the life of a person or persons. It could be medical emergencies, such as heart attacks or strokes, natural disasters such as a flood or a mudslide, other emergencies such as fire and explosions, and more. Dangers to health. Not all emergencies are an immediate threat to life, but action has to be taken immediately to ensure that life is not lost, such as from chemical spills, medical emergencies such as broken bones that need immediate attention but are not life-threatening, as well as natural disasters. Other types of emergencies that pose a danger to property can include bushfires, mudslides, fires in an office, or even storms. Emergencies that create a danger to the environment can include things like oil spills, bushfires, or even chemical spills. Natural disasters can also be classified as emergencies. Things like earthquakes, floods, landslides, mudslides, volcanic eruptions, or even extreme storms and snow. Let us now have a look at some of the most common emergency situations you may find yourself in as a plumber. Things like serious medical emergencies, for instance cancer, heat stroke, diseases, or even heart attack. When it comes to vehicle accidents, you may be affected on public roads or even construction sites. You also have work or task-related emergencies, things like falling from heights, working in excavations, fire and burns, or even serious injuries. Let us start off with serious medical emergencies. One type of serious medical emergency is skin cancer. Most skin cancers are caused by too much exposure to ultraviolet light. UV rays are an invisible kind of radiation that comes from the sun, tanning beds, and sun lamps. UV rays can damage skin cells. Protection from UV rays is important all year, not just during summer. So what is UV? Ultraviolet radiation, or UV, is a source of energy that is released naturally by the sun and artificially from sunbeds. There are two main types of UV rays that can damage our skin. Both types can cause skin cancer. UVB is responsible for most sunburns. UVA penetrates deep into the skin. It ages the skin, but contributes much less towards sunburn. A third type of UV ray, or UVC, could be the most dangerous of all, but it is completely blocked out by the ozone layer and doesn't reach the Earth's surface. You can't tell whether you are at risk of burning by the temperature outside. This is because you can't feel UV rays. People can still burn on cold or cloudy days, even if the UV index is 3 or more. How then can UV cause skin cancer? Too much UV radiation from the sun can damage the DNA in our skin cells. DNA tells our cells how to function. If enough DNA damage builds up over time, it can cause cells to start growing out of control. This is what leads to skin cancer. Anyone can develop skin cancer. but some people can have a higher risk, including people who burn more easily. It is important to remember that skin damage doesn't only happen on holiday or in hot sunny places. The sun is often strong enough to cause damage even when it is cloudy. Whilst we all need some sun to help us make vitamin D for healthy bones, it's minutes rather than hours. There's no need to sunbathe to get enough vitamin D, and there is no such thing as healthy tanning. As a plumber, you are working outside very often. You will also be exposed to the sun on most days. Does sunburn cause cancer? Yes. Getting sunburnt increases your cancer risk. Sunburn is skin damage and your body's response to try to repair it. It is a clear sign that the DNA in your skin cells has been damaged by too much UV radiation. Getting sunburned just once every 2 years can triple your risk of melanoma skin cancer compared to never being burnt. Did you know the signs of sunburn can depend on your skin tone? Sunburn doesn't have to be raw, peeling, or blistering. If your skin has gone pink or red in the sun, it's sunburnt. For people with darker skin, it may just feel irritated, tender, or itchy. So what should you do if you get sunburnt? Well, if you notice signs of sunburn, you could come out of the sun and cover up to help stop any more damage from happening. Putting on more sunscreen won't help and won't let you safely stay out of the sun for longer. After sun lotion can help sunburned skin feel better, but it cannot repair any damaged DNA. Getting sunburnt once doesn't mean you will definitely get skin cancer, but the more times you get sunburnt, the higher your risk of melanoma skin cancer. Reduce your risk of sunburn and protect your skin by using a combination of shade, clothing, and sunscreen. Skin cancer can also spread. Melanoma skin cancer can grow down through the layers of the skin and spread to other parts of the body. Remember, when skin cancer is found at an early stage, treatment is more likely to be successful. If you have noticed any unusual changes to your skin, including a mark or mole that's new, has changed, or been there for a while, speak to your doctor. Try to learn more about melanoma skin cancer symptoms by doing research. It is clear, sunburn is not only painful, but it is dangerous and comes with consequences. Sunburns cause DNA damage to the skin, accelerate skin aging, and increase your lifetime skin cancer risk. In fact, sustaining 5 or more sunburns in youth increases lifetime melanoma risk by 80%. While you are out in the sun every day, working hard as a plumber, try and prevent sunburn. Ensure that this is part of your procedure for any work that has the potential to cause sunburn. Avoid the sun during peak hours of 10 to 2 p.m. If you cannot do this, seek shade. Wear clothing with UPF protection, ultraviolet protection factor. This is UPF 50 or plus. This helps block out 98% of UVA and UVB rays. Wear sunglasses with UV protection. Try and wear a wide-brimmed hat. Always apply sunscreen at least 15 minutes before going outdoors, even on a cloudy day. The sun or heat can cause other serious medical emergencies, such as heat stroke. Excessive exposure to heat can cause a range of heat-related illnesses, from heat rash and heat cramps to heat exhaustion and heat stroke. Heat stroke is a condition caused by your body overheating, usually as a result of prolonged exposure to or physical exertion in high temperatures. This most serious form of heat injury, heat stroke, can occur if your body temperature rises to 40 degrees or higher. The condition is most common in the summer months. Heat stroke requires emergency treatment. Untreated heat stroke can quickly damage your brain, heart, kidneys, and muscles. The damage worsens the longer treatment is delayed, increasing your risk of serious complications or even death. Here are some symptoms of heat stroke to look out for. If you have been exposed to too much heat, you may feel tired, dizzy, have a headache, feel sick or be sick. You may have excessive sweating, or your skin may become pale and clammy. You may have cramps in your arms, legs, and stomach. You may have faster breathing or faster heartbeat, a high temperature, be very thirsty, and be very weak. For effective emergency management, your first aiders must know and understand the treatment for heat stroke. Ensure that this is part of your procedure for any work that has the potential to cause heat stroke. First, you want to call the emergency services. Remove any excess clothing and cool the person down with water or by fanning them. If the person is awake, allow them to drink a little bit of water. Keep the person cool at all times. Use a wet towel over their forehead and neck. Elevate their feet and let them rest until help arrives. As a plumber, you want to prevent heat stress. Start off by knowing the signs and symptoms. When you know what to look for, you may be able to prevent muscle cramps from accelerating to heat exhaustion or heat stroke. Monitor yourself as well as those who work with you. Be diligent about watching for the signs of heat stress as well as treating them immediately. Shield yourself from the sun, open flames, working in hot weather, or when you are suffering from heat stress. Use the shade as much as possible. Wear appropriate sun protection, personal protective equipment, and perhaps an approved sun cream recommended by your medical practitioner. While it is possible that you have already been able to acclimate to high temperatures outside, it is important to have cooling fans or air conditioning indoors where the air is not moving to aid in sweat evaporation. Serious medical emergencies from disease could cause danger to your health. As a plumber, you may be exposed to sewage and contaminated soil. Diseases involving sewage can have an instant effect on the human body and see a quick spreading of bacteria. Three main health risks are made present due to the effects of raw sewage, such as viruses, bacteria, and parasites. These viruses, bacteria, and parasites can cause intestinal, lung, and other infections. If equipment, work practices, and personal protective equipment don't protect you from swallowing these agents, you can get very sick. Legionella, a bacteria that is found naturally in water and soil, can cause disease, as well as lead to serious medical emergencies. This genus, Legionella, is a pathogenic group of gram-negative bacteria that includes the species L. pneumophila, causing legionellosis, all illnesses caused by Legionella, including a pneumonia type of illness called Legionnaire's disease, and a mild flu-like illness called Pontiac fever. We all remember the worldwide pandemic and the disastrous effects of COVID-19. On Wednesday, the 22nd of June 2022, those regulations 16A, B, and C relating to the surveillance and the control of notifiable medical conditions were repealed. As a result, COVID-19 regulations such as the wearing of masks, limitations on gatherings, and entry requirements of foreigners into South Africa were officially lifted. However, the repeal of the above regulations is not specifically directed at employers and their workplaces. All employers still have an obligation in terms of the Occupational Health and Safety Act to provide, insofar as is reasonably practicable, a safe working environment. This is also in line with the Code of Practice, managing exposure to SARS-CoV-2 in the workplace and the Hazardous Biological Agents Regulations. In terms of the Hazardous Biological Agents Regulations, COVID-19 is classified as a Group 3 hazardous biological agent. This presents a risk in respect of an agent that may cause severe human disease, which presents a serious hazard to exposed persons, and which may present a risk of spreading to the community. Where there is a risk of exposure to COVID-19 in the workplace, an employer must conduct a further risk assessment before determining whether employees are no longer required to wear masks, as well as revise their workplace plans. This means that appropriate measures must be taken. As part of the risk assessment, employers must ensure that an employee's risk of exposure to COVID-19 is limited through appropriate workplace measures such as vaccination, the wearing of masks, practicing social distancing, and sanitizing. These kinds of precautions may be necessary, especially in workplaces where there is a high risk of COVID-19 transmission, such as those in healthcare and mining. In these workplaces, employers may still insist that employees continue wearing masks in the workplace as part of their risk assessment, regardless of the latest regulations. Monkeypox is a rare disease caused by infection with the monkeypox virus. This virus is part of the same family of viruses as smallpox. Monkeypox symptoms are similar to smallpox symptoms, but milder, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox. As mentioned, infections with a strain of monkeypox virus identified in this outbreak, the West African strain, are rarely fatal. Over 99% of people who get this form of the disease are likely to survive. Our emergency management procedures must include people with weakened immune systems, people with a history of eczema, and people who are pregnant or breastfeeding, as they may be more likely to get seriously ill or die from these types of diseases. Although the West African strain is rarely fatal, symptoms can be extremely painful, and people might have permanent scarring from a result of the rash. Here are some symptoms of this monkeypox disease. Perhaps you can make this part of your emergency management plan. Fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion, or a rash. What should your emergency management procedure say if you have found symptoms of monkeypox? The first thing to do is see a healthcare provider if you notice new or unexplained rash or other monkeypox symptoms. Avoid close contact with others until a healthcare provider examines you. Avoid close contact with pets or other animals until a healthcare provider examines you. If you're waiting for test results, follow the same precautions. If your test is positive, stay isolated until your rash has healed, all scabs have fallen off, and a fresh layer of intact skin has formed. Our emergency management plan as a plumber might also include the serious medical emergency of a heart attack. Heart attacks are caused by the blood supply to the heart being suddenly interrupted. Without this supply, heart muscles may be damaged and begin to die. Without treatment, the heart muscle will experience irreversible damage. If a large portion of the heart is damaged in this way, the heart stops beating. This is known as cardiac arrest and often results in death. One of the leading causes of heart attacks is coronary heart disease, or CHD. CHD is a condition in which the coronary arteries, the major blood vessels that supply the heart with blood, become clogged with deposits of cholesterol. These deposits are called plaque. Before heart attack, one of the plaque ruptures or bursts, causing a blood clot to form in the site of the rupture. The clot may block the supply of blood to the heart, triggering a heart attack. Your risk of developing CHD is increased by smoking, having a high-fat diet, having diabetes, high cholesterol, high blood pressure or hypertension, as well as being overweight or obese. Making lifestyle changes is the most effective way to prevent having a heart attack or causing this serious medical emergency. There are 3 main steps you can take to help prevent a heart attack as well as a stroke. Eating a healthy, balanced diet, not smoking, and trying to keep your blood pressure at a healthy level.